Next up, here to talk about avoiding market access bumps and why understanding the regulatory landscape is critical to your business. Already jumping on our stage, Christian Pinnow, partner at D+B Lawyers. Hello there. It's all yours. Enjoy.
Hey, thank you very much. Hello, welcome everyone. I'm here to speak about why it's necessary to understand the regulatory landscape that you are going to access with your business idea and your business model. Let me quickly introduce myself. My name is Christian Pinnow. I'm a partner with D+B Lawyers. We are a Germany-based law firm that is focused on healthcare. And it's solely focused on healthcare, and we are working with 30 partners, 30 lawyers, not 30 partners, sorry, 30 lawyers to help people accessing the German healthcare market. If you think of accessing a market and understanding the regulations, I think it's necessary to start with a switch of perspectives. Leave the perspective you have on healthcare provision and switch to the perspective of the regulators and the regulations. This is how healthcare provision looks from the perspective of the regulator. There's a patient in the physician's office. He's talking and he's examining the patient. And this is what the data processing looks like from the perspective of the regulator. There might be a computer, and there's a lot of paperwork, and there's fax machines. And all in all, the regulator thinks that the clinical location is only the physician's office. This is the place where the health data are collected, and these data are collected actively, which leads to a moderate amount of data, and only the physician makes the clinical decisions. Now switch back to our perspective on these things. This is what we all heard about in the last 1.5 days. We are using smart devices, we are using wearables, we are using remote technology in order to provide healthcare. Which means that the clinical location is the person itself. Wherever you are, that's your clinical location. Smart devices collect the health data, which leads to, first of all, a passive but also permanent data collection, and thus to a huge data volume. And this leads to the decision-making supported by artificial intelligence in order to process all the data that were collected and in order to process the medical information that is on hand when it comes to clinical studies and all the medical ideas you have. And if you compare these two perspectives, you will see there's a huge gap. A gap between the regulator's perspective and your business ideas. And what you need to do, when it comes to my opinion, is you have to bridge this gap. And how do you do this? First of all, of course, you have to understand what the gap is. And once you understand it, you have to work with the regulations that you found in place. And most of the times you will have to adapt your business model. And this is something that goes for almost every jurisdiction in Europe. It's not only a German topic. And what are the two questions that you have to answer yourself when it comes to this? First of all, the main question is my business model lawful in the market I'm going to access? This seems quite a no-brainer, but it isn't. Just an example. We were asked by a client who already provided services in Switzerland to help them access the market. And they described their business model to be merely based on service provision through physicians that are employed with this company, with our client. And this was kind of a showstopper for the German market because the German regulations don't allow it. It's only permitted to provide outpatient services through self-employed physicians in their own practices. So we kind of found a blocked road. And the question we had to ask is, do you turn around, which means not accessing the market, or do you find a way around it? Do we take a detour? And we worked on that, and we found a detour, which meant huge changes to the business model. But however, our client accessed the market because he understood what kind of regulations will apply for his business model. The second question, when it comes to bridging the gap between the regulations and your business model, is whether or not your pricing model is in line with the market and if it complies with the regulations applicable. Thinking of Europe, the statutory health insurance and its regulation on reimbursement and remuneration have a major impact on business models because mostly these regulations overlay self-payer business models. Why is that? Thinking of Germany, around 90% of all the Germans are insured with the statutory health insurance, which means that they already pay 15% of their gross salary for healthcare. And this leads to the fact that most Germans are not willing to pay extra money out of their pocket, or maybe not able to pay extra money out of their pocket in order to receive healthcare provision. And this goes no matter how great your idea or your services are. This is what we experienced. So, thinking of that, you have to ask yourself the question, do I take the risk? Do I access the market with a self-payer model? Or is there a way to be part of the SHI system? Is there a way to be remunerated within the system? And since we're here at a health tech conference, I would like to show you some German regulations that help you accessing the market. What we have in Germany is regulations on DiGA. DiGA is short for Digitale Gesundheitsanwendung, which means it's a digital health app, and it can be delivered to the patient upon prescription through the physician. And what is a DiGA? It's an application software, which is a medical device according to Class 1 or 2A MDR, and its main function is essentially based on digital technologies and has a purpose to support the patient or the service provider in the care of the patient. And its aim is to detect, monitor, treat, or alleviate diseases, injuries, and disabilities. And if you have an app that meets these points, you might have a chance to be a DiGA and to be remunerated within the system. And it all starts with your application for inclusion in the DiGA directory, which is maintained by the BfArM, that's the competent authority in Germany. And once you are in this directory, the doctors can prescribe your app, just like a prescription doc. And the patients download this app and use it, and you are being remunerated by the SHI. So this is a way to monetize your business model without being a self-payer model. And there's a rather fast track into the system because there's only 3 months between your application for inclusion and the inclusion in this directory. Of course, as long as you meet the prerequisites. And once you are in this directory, you are live. People can download these apps on prescription and you are being remunerated. There's a time of 12 months when you already start with your app, and after these 12 months you negotiate the full price, which is going to be in the market from there on. And this does work, which can be seen by the fact that there's a lot of companies right here that are already DiGA manufacturers, and they are being remunerated within the system. And this is not only going for Germany, because France is already adapting this kind of idea in its regulations, Austria as well, and as I learned yesterday, Poland is thinking of the same thing. So knowing these kind of regulations might help you to access the market. And now you might ask, why am I telling you this? Because I think accessing a market is something like climbing a summit of a mountain. And when you think of this as your map to the summit, and this is only a part of the roadmap when it comes to becoming a DiGA, I ask you and everyone around here, would you rather having the map in your own hands, trying to reach the summit, or would you rather guidance by someone who has already been there and who knows the way in? And this someone could be us. And this is what I'm what I wanted to present to you, and I'm happy to answer any questions.
Ladies and gentlemen, do we have any questions for Christian? That's a big one. Yeah, we do.
Thank you very much, Christian. I have a quick question. Does this apply if your app does something that requires, for example, an omics analysis prior? Or is this just for apps that are a standalone sort of software? And the second question is, how do you decide on the reimbursement price? So you said you have a temporary thing, and then you set the price. How is that done?
Okay, can you repeat your first Can you repeat your first question? I didn't really get it, sorry.
The first question is, if you have an app, but it needs, for example, you do omics analysis of a sample, and then it's the app that actually constructs the report, does that count, and is it eligible for this? Or because it has that, it's rather an IVD, and so you have to go the traditional way?
Well, it is possible to have a DIGA which needs some kind of device just to collect data or biomarkers or whatsoever. And this can be an app, and there's a more complex way to get the device reimbursed, but it is possible. The second question was about the price. In the first year, after being included in the directory, you are free to choose your price. That's what the law says. Actually, there's a cap that has been negotiated, and so you might very well check if you are in compliance with this gap and if your plans are there, because there have been some companies that were demanding huge prices, and once this negotiation after 12 months was finished and the price they agreed upon was lower than the price in the first year, they just claimed the overpaying back. So this is something you have to keep in mind when it comes to fixing the price.
Is it a hard set cap, or does it depend on the application and how you negotiate your premiums over what already exists?
The second aspect.
Say again?
Second one.
Okay, thank you.
Any more questions for Christian? Do we have one more? Yeah, we do.
Hi, I'm sort of curious, what is the most common misconception that you face when people first come into your office with their questions?
Well, actually, it's the idea of self-payer models, and we are being pitched a lot of great ideas, but as I said, no matter how great your idea is, people are not willing to do so. And we've seen a lot of ideas that died upon their journey into the market just because of that, because there's no one who wants to pay 50 euros a month for something, how great it might be.
And there we have it. Thank you very much again, Christian.
Thank you very much.